Am I starting? Oh, we're live. Okay, great. Good afternoon, morning and evening, wherever you are. My name is Pam Das, and I'm an editor at the Lancet Medical Journal and co-custodian of our global health work at the journal. I'm really pleased to be hosting the launch of this important initiative to address the data gap in mental health. One of the key recommendations from the Lancet Commission on Global Mental Health and Sustainable Development, published in 2018, was to establish a monitoring and accountability mechanism that uses a broad and integrated set of indicators to monitor progress for mental health. In response, the Countdown Global Mental Health 2030 is launching its first report today, which focuses on child and caregiver mental health, which is particularly important. It's a developmentally sensitive period in the life course, and we know that most mental health disorders in adults originate in childhood. And so targeting interventions and risk factors at this period of life have the largest effect. And so it's great that the first report is going to be focusing on this. So we're then also going to hear and see the dashboard of data which accompanies the report, and that's an interactive platform whereby all of us can interact with the dashboard and look up selected indicators and information relevant to our countries, and we'll hear about that shortly. We're going to hear from different speakers and perspectives from the partners of this initiative, and there'll be an opportunity for you to ask questions to our panelists. So do think about those now and send those through the chat function. The Q&A function, sorry, the Q&A function. Right, I'm going to hand over first to Professor Shekhar Saxena, who was a co-lead on the Lancet Commission on Mental Health, to talk about the background to Countdown 2030. Shekhar.
Thank you very much, Pam. It started with the Lancet, so it's very pleasant that you are chairing this session, actually. And also greetings to all the panel members as well as the people who are attending this. And I would very much like this session to be interactive, so you already mentioned that. I would take us back to 2015 when the prime ministers and presidents met in New York in the United Nations and included for the first time mental health as a part of the Sustainable Development Goals. This really lifted mental health only as a discipline of health sciences to an integral part of development. The message was mental health is too important just to be a health issue. It is indeed a developmental issue. After that, as you said, in 2018, me along with a very large number of collaborators worked for almost 3 years to produce the Lancet Commission on Global Mental Health and Sustainable Development, which reviewed the evidence towards what could be done for mental health as a part of the sustainable development and where the countries are and where do they need to reach really with that. One of the recommendations was that we lack data. We lack data on a longitudinal basis so that we can actually measure the progress for mental health that we are able to make. This also really initiated the basic principle that mental health is larger than mental disorders. It's not only about disease, it's about all of us, because we as human beings have mental health as one of the essential attributes, and we need to really protect it, we need to preserve it, we need to promote it. And of course, if we have a mental health issue, we need to take care of that. So that was the comprehensive dimensional nature of mental health that the Lancet Commission established. And also it suggested that a monitoring and accountability mechanism needs to be put in place so that we can know where we are and how do we make progress on that. It's very nice to see that a large number of partners, including UN agencies, WHO and UNICEF particularly, civil society partners, including the Bernard von Leer Foundation, and an academic institution like the Harvard have joined hands and produced this first report and the first dashboard on the countdown. In spite of the COVID-related restrictions, we were able to work on it, although we wanted to launch it in 2020. But it's never too late to measure and to see where we are. So I'm really very pleased that the day has arisen when we are able to launch this report and this dashboard for people to see what the indicators are for mental health within the wider perspective of the developmental issues, where we are on that, and how do we make progress on that. The dashboard, as you will see very soon, has three large sections: the determinants of mental health, the demand and need for mental health, and the mental health services and systems. And we have been able to collect data from many sources, including given by WHO, given by UNICEF, and collected from the UN portal and many other portals, as is described in the report. And to put it at one place so that one can see how the indicators are for different countries. And we are fortunate enough to be able to collect data from almost all countries and put it together in this dashboard, which is interactive. So I would very much like you to play with that and see to what extent you're able to use it. And in this webinar, we are going to hear the user perspective, which is absolutely essential, so that we know what is working not so well, and how we can improve it. The plan is for the countdown to be continued till 2030, which is the deadline for the Sustainable Development Goals, and see that we can use data to change policy, to improve things, to achieve the objectives of the SDGs. I know that the dashboard is, like all dashboards, a little complicated. So I like to invite James to show us a video which will just show you some of the elementary things that can be done on the dashboard. And of course, we are happy to explain more and make you use the dashboard in the best possible manner. James, please.
Welcome to Countdown Global Mental Health 2030, the first independent monitoring and accountability mechanism for mental health, and which has the aim of driving action to campaign, action to advocate, to communicate, and to change policy and practice so that everyone everywhere is able to exercise their right to the highest attainable level of mental health. Countdown 2030 is accessible through the United for Global Mental Health website. Here you'll find lots of details about Countdown 2030, and including a link to the annual report, which goes into the need for better data for mental health in much more depth and provides methodology for Countdown 2030 itself. Countdown 2030 is a partnership between United for Global Mental Health, the World Health Organization, UNICEF, Global Mental Health at Harvard, the Global Mental Health Peer Network, and The Lancet. Let's look at the data. The data and indicators are framed into three components: determinants of mental health, such as poverty rates, factors shaping the demand and need for mental health care, such as substance use, and factors shaping the strength of mental health systems, such as government spending. The data is presented in a number of ways. Firstly, through heat maps. Here, through this drop-down menu, you'll be able to access all of the 53 indicators. More data is given in the maps themselves. Here you'll be able to hover over a country, and that will give you more information about the indicator itself, what the source is, what the country is and the value for that indicator, the year the data was collected, and an interpretation of the legend. Here, dark blue means less, and dark red means more. The data is also presented as a table. Here, all of the indicators in all of the countries are shown, so we can see the data throughout the table. But it's also possible to narrow the data to give yourself a bespoke table, which is useful for what your needs are. You can select specific countries, and also specific indicators. To create a table that you need. All of these tables and all of the data is available to share and to download. Data is not available for all of the indicators in all of the countries. This is something that Countdown wants to improve. Here, through this bar chart, we can see the numbers of indicators where there is no data for each country. This is then broken down into the different components of the Countdown 2030 framework. This allows the viewer to see what data is missing in which areas. Countdown 2030 is designed for action, to provide the data that you need to make mental health across the world better.
Great. Thank you very much, James, for having a run through the dashboard. I do encourage you after the session to have a play with it. It's great how much information is out there. Right, so as I said before, we're going to hear from some of the expert panelists and some of the partners behind this initiative. I'm going to start with asking a round of questions to each of them individually. My first one is to Suraj Karala, who is the technical advisor of Transcultural Psychosocial Organization in Nepal, otherwise known as TPO. Suraj, are you with us? Hello, good afternoon.
Hi, yeah.
Hi. So the first question is for you. Data and evidence has been very important in the TPO successfully persuading the Nepalese government to update the provision of mental health care in Nepal. Can you tell us more about the role that data has played in that?
Well, thank you so much, Pam. It's a very important question as is quite relevant in our context. The data generated through the research were actually played crucial role in terms of the revision and adaptation of the policies on mental health in Nepal. The Ministry of Health and Population Development Healthcare Package that is based on the data that we have generated mainly with the PRIME project is called Program for Improving Mental Health Care, which was the research consortium of 5 countries in Asia and Africa. And there were a number of universities involved and collecting credible data and evidence. Publications were made and in peer-reviewed journal, and presentation was done in various forums, also in with the Ministry of Health and Population. So we also invited political leaders to sensitize them about the key findings of the research. Then that the mental health care package was developed, and then also the government, they have actually developed the training modules and standards for the healthcare providers that was based on MSGAP, the modules. And that was, and after that also the government, they have actually allocated some funds to train the healthcare workers and also, the provide psychotropic medications in the community health facility. So which we found is, the based on the data that we have generated from the projects now is being used in the government program, and that really played a key, the milestone in the context of Nepal. Yes.
Thank you very much. It's really good to hear how things happen in country like that. My next question is for Liliana Cavajal. Liliana, you're there? Liliana is the focal point for maternal, newborn, child and adolescent health at the Division of Data Analysis, Planning and Monitoring at UNICEF. Liliana, hello, welcome. Why is data important to UNICEF's work on mental health as an agency who's very much out there in the field?
Thank you, Pam. I really appreciate this question. For UNICEF, data and research have been identified as key strategies that will advance global mental health through evidence generation and scalable strategies and local solutions for reaching children, adolescents, and families who are also putting a lot of emphasis on caregivers now in the work on mental health. This will allow us to have effective and acceptable interventions based on evidence. So for example, we're releasing next week, in October 5th, the State of the World Children Report, which uses a lot of data coming from various data providers or institutions like WHO, Institute of Health Metrics on modeling estimates on prevalence, and a number of other data that has come recently from the field, from different studies. And we believe that this type of estimates and data are very important in informing the field and informing how we make decisions and how we prioritize. And I mean the community that works in mental health, the global community, the regional offices, country offices, how we monitor, how we make decisions in terms of mental health. So data also doesn't exist in a vacuum, as you know. It is supported by so many things in the systems that we work on. We need to strengthening data systems. We need capacity building. We need to work together as partners to be able to provide a solid evidence base. So these are some aspects for which we think data, and in particular this sector of mental health, is so important and truly needs to be strengthened. Thank you.
Great, thank you very much, Liliana. Right, I'm going to move from data to Cecilia Vaca-Jones. Cecilia is the Executive Director of the Bernard Lee Foundation. Good afternoon, Cecilia. Where do you see the greatest opportunity for investment in child and caregiver mental health data?
Thank you, Pam, and hello, everyone. It's a great pleasure to be here and to actually see the dashboard live. I think it's a great tool. And I can see a lot of opportunities, Pam, but maybe I would like to highlight a couple. And coming from the field of early childhood development and the work that we have been doing in different countries, of course, working with different ministries as the Ministry of Health, the Ministry of Social Development, Ministries of Education, ministries, or whoever's running like the nutritional strategies, we see more and more how mental health becomes one of the key indicators to monitor and learn about. So the first thing I want to say, being able to access this data, it is an opportunity not only to create the awareness that we need in order to make mental health a relevant topic for everyone, but I think it's also a great tool to basically inform policymakers or which are the main gaps that we have. And I think, especially when thinking about the well-being of babies and toddlers, we want to make sure that caregivers have a good mental health, because as you were saying before, if we know that mental health has a huge impact in the development of a child and the impact this might have in their adult life, we also want to make sure that the caregivers who are responsible for ensuring a good start in life are also able to enjoy a good mental health. So for me, one, the opportunity creating awareness, which is globally. Second is using the tool in order to inform policymakers of which are the main gaps that they might have. So I can imagine, going to the Ministry of Health of any country and just like showing them which are the specific metrics where some countries might be having gaps or why they don't have any data on specific metrics. And third, but not least, I think that data should allow us to change behaviors towards mental health. And we do work a lot about that, right? Because sometimes we blame caregivers for not delivering the right parenting. But if a parent is under a lot of stress, if a parent is suffering from any kind of mental health illness, then we cannot expect from them to deliver their best. So I think we need to ensure this environment that really enables a good start for all children. I'm very happy to see this tool. I see many different opportunities. Thank you.
Thank you. Thank you very much, Cecilia. And my final question is going to go to Taryn Dewar, who is at the WHO. Taryn is the head of brain health, the brain health unit in the Department of Mental Health and Substance Use at WHO. Welcome, Taryn. How can a global organization such as WHO work with others, such as civil society organizations, to improve data for mental health?
Thank you, Pam, for this question. And as from what is coming from the chat box, there's a lot of interest in data. And we all know the saying, if there is no data, that means people say there is no problem, and no problem means no action. And I think, and that's what we have been facing in the field of mental health since many years. Many of you might have heard about our mental health atlas. So at one side, we have the figures and the numbers that are related to the burden, what's the, in prevalence, in cost due to mental disorders or mental health conditions. And then what are the resources available at national level? And this is where Mental Health Atlas comes in, where we have been publishing data from the World Health Organization for last 20 years. Now, if I can summarize in one line, what's the state of the data currently, and looking at the trends, there is a raising prioritization of mental health, and people are understanding the need for doing much more in mental health. But unfortunately, the data systems are not yet there. What we see in other fields, such as in infectious diseases or in maternal and child health. And so that's where comes in the importance of strengthening of mental health information systems linked to the general health information systems, and the SDGs provide us the platform to do that better. And when we talk about the strengthening of the health systems, it is at both at this which is required to strengthen the health systems at the national level, but also at subnational level, sub-regional level, and to have systems that are that can help in harmonization of the data collection systems. A few suggestions, simple tips that I would like to share. For example, one could be that the countries have compatible set of indicators, such as they are in the Atlas or Mental Health Action Plan and nationally relevant targets. The second is, which is very important, is that when we think about mental health data, that we take an intersectoral approach. Because many of these are important in terms of the social care. And the third is, when we think about better data, is that in addition to quantitative data, we have a qualitative approach so that we can take into account the human rights and a person-centered approach that will be very important. There are quite a few tools that are available. What it requires is the commitment from the governments, commitment from other stakeholders to have those better data systems built in.
Great, thank you very much. Great, thank you, Taryn. Right, so we're going to go for another round of questions to our panelists. I'm going to start with Liliana this time. Liliana, if you could ask data specialists to focus on one solution for child and caregiver mental health data, what would that be?
Thanks, Pam. That's a great question. Well, a lot more needs to be done to fill this data gap, and I'm very happy to hear Tarun's suggestions in terms of standardization of indicators and multi-sectoriality approach. That's super. That's basic. Also, we need to work together as a community to really work in the different aspects that will help us get there. For example, strengthening of systems, working with teams in countries to provide capacity development, capacity building to be able to collect this data, and reporting through different sectors, health, education, child service. As an example, UNICEF, in collaboration with partners and other institutions like WHO, we are developing a set of data collection tools to collect data on different aspects of mental health. We call this effort the MMAP initiative, in which we are validating modules regarding mental health, like prevalence of key disorders like anxiety and depression, functional limitation, even some aspects of suicidality, and other aspects like connectedness and mental health. So we're working as a community to get this off the ground, to allow countries, support countries basically, to be able to collect data from households, from schools, and from other platforms, and start closing that data gap that is so important for us as a community. Thank you, Pam.
Great, thank you very much. My next question is to Taryn. Taryn,
Yes, Pam.
Hi there. Sorry, I asked you a first question in the second round. You should have corrected me, but that's fine. I'll ask you about the updated data for the Mental Health Atlas, which you did mention briefly, but perhaps you could just give us a preview of the headlines of that data and what is missing.
Thanks, Pam. So Mental Health Atlas, as I mentioned earlier, is where we have been publishing from the World Health Organization, and so you heard from Shekhar, who has been very much has been the architect of this Mental Health Atlas in 2001. This is now the vehicle or the monitoring mechanism for the Mental Health Action Plan. So which all the countries endorsed in 2013, and this is being published regularly. And the first in 2014, and I'm talking about linked to the action plan, and then in 2017 and 2020. So so this is a teaser or a trailer of what the Atlas will be telling us in a week's time when it will be officially launched. But what I wanted, the good news is that we have many countries, even when hit by COVID-19 pandemic, they reported data. So 171 countries, they reported it. And looking at it in perspective, this is not very different from the number of countries that have been reporting data to WHO in 2014 or 2017. The bad news is that if we look at the progress towards the Mental Health Action Plan targets, we are not there. And I think there is a lot that needs to be done. So for example, just taking an example of one of the indicator, which is for the policies, only 50% of the countries have policies in line with international human rights instruments, while the target was 80%. So we are very much behind. And that is true for all the different targets across the action plan. So this is I would say a wake-up call for the mental health community, that we need to do much better. I talked about the the availability of policies and availability of laws and availability of the services. At the same time, there is a remarkable gap that is happening in terms of the implementation of services. So taking an example, for example, the guidelines for integration of mental health into primary health care, incidentally, which is a new indicator that has been added. While countries may report they have guidelines, when we ask them whether they are functional, only 1/4 of the countries report having such kind of functional implementation. And similarly, when we look at the mental health expenditure, it still remains low. The service coverage remains very low. And last point, which is relevant for today's discussion that I wanted to make, that there are there are some countries who are not reporting, but then also we do not have complete set of data from all the countries. And this low completion rate is because such data does not exist in the country, not that the countries don't want to give us the data. So I'm going back to my first comment that I made earlier, that there needs to be investment in having better data systems, functional data systems, harmonized health information systems. And we have seen with COVID that better data is coming in some areas. So the question is that how can we use this opportunity to build back our data systems better in the countries?
Great. Yeah, it's a very comprehensive response. Thank you very much. My next question is to Cecilia. Cecilia, hi there. Accountability is critical to progress in mental health, and this relies on good data. What should we be holding actors, such as governments, accountable to for child and caregiver mental health?
Thank you, Pam. I think that's a very interesting question, because as you say, of course, these dashboards depend on reliable data. And I think in order to have reliable data, you need to ensure, especially with governments, to create this access so you can collect good data. So from my perspective and from the work that we are currently doing in our work with local governments, with national governments, we really need to enable the environments to collect good data, starting from the primary care services, which I think it's of course for me the first access where you can scan somehow like different problems or different situations that you can identify on the ground. But I think, as one of the previous panelists was saying, I think this data should also be able to be informed by community members, so having different ways to collect the data. But from the services itself, I think as far as we can ensure systems that can integrate data, and especially integrate data that relates caregiver and maternal indicators is very essential in order to have this reliable data. And also, I think it's important to be able to integrate this data at a national level. But I think for accountability issues, is important to analyze this data to understand where are the gaps and how we can then take decisions, understanding which are the biggest gaps. Finally, I think in some cases, I think decentralizing a lot of this data is important, because in many cases, and even if we see the dashboard right now, you have aggregated data, but then in order to take decisions at a very local level, you also need to be able to access decentralized data. So I think for me, this is some of the most important things in order to ensure this accountability.
Okay, great. Thank you very much, Cecilia. Right, and I'm going to turn to the last panelist, Suraj. The Countdown 2030 platform is about using data for action. What action do you want to see this data be used for?
Well, I think that's really very important question, and thank you, Pam, for this. And one of the key issues that I have seen, especially in the countries like Nepal, that especially the health information surveillance system, we have worked a lot on the integration of mental health into primary healthcare centers. That's the service, the part we have done our job, at least at one level. But the health surveillance information surveillance system is yet to be highlighted and strengthened. That's why we can ensure the quality of data that we have been collecting and also being the compile on that way. The second thing is also we want to see the mental health is in the health system, but also in the protection and education system at all level of the government, and it is yet to be explored more. On that particular aspect, so that we can make the mental health services more accessible, more feasible, and more the cost effective in the countries like Nepal. So yeah, that's what I wanted to say. Thank you, Pam.
Great, thank you very much. So that concludes that second round of questions. Thank you to all the speakers for that. I'm going to put you back on the spot again, as we do have several questions from the audience, which is great. So I'm going to try and target them to the person that they who could best answer, but actually it's really open to all of you. So the first question here, perhaps for Liliana or Suraj, can people with psychosocial disabilities be trained to also be involved in the collection of data? As I said, if it isn't for you, anyone else that would like to answer that?
Okay. Yeah. I mean, I can start. It's really very important, the aspect of the whole mental health, the programs, and I think when we do have some initiation that we have done in our training programs. We included the people with lived experience involved in our training, and have delivered their the experience and all these the things they have experience in their life. So that will actually improve. That will actually have a lot of impact, positive impact, in terms of the participants who attended the training. And that was I think the information they are sharing, and if we can if we can compile those informations and make the cases that will have a lot of, the big, the impact in overall mental health programs, and listening their voices will be, the really helpful to make the program more effective. Yeah.
Thanks. I can add to that quickly. For example, what we're doing at UNICEF and with partners in terms of data collection is the idea is to train data collectors to be able to collect data on these, topics that can be sensitive, like mental health, even, ideation of suicidality. And then, as Suraj mentioned, working with people with lived experience would make the experience more wholesome, right? They will have the sensitivity and the understanding of talking about these topics. But as I said, provided that there's like careful and thorough training so that the work can be conducted with responsibility and appropriateness. Thank you.
Pam, this is Shekhar. May I just add a point?
Yes, sure.
I think this is extremely important. And so far, the WHO Atlas as well as the countdown data is essentially collected from government sources. And we do recognize the limitations in that. Many governments want to paint themselves in better light than actual the realities are. So the attempt is to develop the countdown in future and collect information from civil society partners, including qualitative information, and also from people with lived experience, so that they can tell us whether what the government says is actually practically happening on the ground or not. And if not, what could be done about that? So that certainly is important and is part of the future development of the countdown. Thank you.
Great, thank you. We have a great question here. What is the role of the private sector in mental health data? Be great to hear from our speakers. Anyone want to take that one?
Pam, I will add a point. I think it's extremely important to involve the private sector also in limited ways and realizing the limitations of that. And let me give you an example. It will be extremely important for private sector, including large employers, to actually collect data voluntarily, of course, from how the mental health of their employees is and how it is changing over time. For example, during COVID period, we do know that a lot of us have had much more stress. And that brings me back to the dimensional nature of mental health. We just don't need to count the people with mental disorders. We actually need to see how the population mental health is doing in terms of its dimension, in terms of promotion. And there the private sector can be extremely useful to find out what is happening to the communities and how that can be done better. So I think there are value in collecting data from private sector, and they can certainly contribute to the effort of better data and better action.
And are you finding, Shekhar, that when you reach out to the private sector, they're quite happy to be involved? Or is there some tension there?
I think the private sector has moved very well in the last 10 years, and of course, much more in the last 1.5 years after COVID. So they are realizing that mental health is an important part of the work that they do. And it actually adds to the bottom line. It adds to the well-being of the employees and eventually in terms of the profit margins and things like that. Yeah. So yes, the receptivity is definitely higher. But yes, some of them are still shying away. And my request is for them to realize that the mental health is too important for them to be ignored, really. And the countdown can really pave the way for them to do so.
Yeah, I agree. I absolutely think that's very critical, especially in our sort of employment sectors, certainly at the workplace. I'd like to ask a question, if I may, before I take another one from the audience, and that is the Commission, going back to the Lancet Global Mental Health Commission and Sustainable Development. One of the clear sort of outputs of that was stating that research consistently shows a strong association between social disadvantage and poor mental health. And I recall that the Commission reported that things like poverty, childhood adversity, and violence are key risk factors for mental disorders. And the COVID-19 pandemic has further focused, I think, attention on the importance of social determinants in causing both mental and physical illness. How easy is it to measure those kinds of social determinants using the countdown mechanism, the tool that you've created? Because those are much harder to get a handle on, aren't they, in terms of numbers and things like that? You can't really do that for those kind of social determinants. How are you going to be addressing those?
Pam, actually, it has not been very difficult to collect those indicators because there are mechanisms, for example, within the World Bank, also within the UN, and it does collect data on things like poverty, also violence against children. It collects data on educational performance, which are also related to the mental health of children as well as adults. And so I think we have been very successful in identifying and collecting those data. But let me point out a limitation to that. The data is usually, and that we collected, is at a country level. And there are intra-country differences within population groups, for example, which we have not been able to focus on. And so our attempt now is to actually work with the country partners to do country countdowns, which can then drill down on the specific population, which is underprivileged, as you said, and then have policies which can proactively improve the situation of that. In fact, many academics, and I included, say that the investments in improving the social and economic determinants are eventually in long term are going to be much higher than improving the treatment systems. Of course, both are necessary.
Yeah. Thank you. Thanks, Shekhar. Right, a question back to our audience again. A question for Liliana, but others can step in. How is mental health resource allocation counted if one takes a multi-sectoral approach?
Right, I agree with your face, Pam. Difficult question.
I'm not sure I actually quite understand that question, but perhaps whoever asked it may want to clarify.
Maybe
Tarun wants to respond.
I can start based on my understanding. So I think this is in terms of mental health expenditure or within the national health accounts. I think this is we try to get some basic information through Mental Health Atlas, and you can find the methodology and on our website. The point that I wanted to make it is this information is not readily available for various reasons. One, in many countries, the national health accounts, they do not have disease-specific line for mental health, for example. So that information is difficult to find. Second, when we look at mental health, it's not only the health sector resource allocation, but it is the resource allocation from other sectors that is also important, like social care, for in terms of and when we are looking at that, we need all of this data to be combined, and that is very difficult. So for example, when we ask countries about what is their mental health expenditure as percentage of their health expenditure, only 1/3 of the countries, they come back with any value, and that is extremely difficult. And that's why I think and then when we ask them what percentage of that budget is going towards mental hospitals, primary healthcare services, specialist services, they don't have that information. So it is one of the tough data pieces to get information on, and we have been struggling with since we have been collecting this information through Mental Health Atlas.
Right. Thank you, Tarun. Another question for you, Tarun, possibly a bit similar to the private sector and how they can be involved. How do we involve the non-profits in data collection and use? Cecilia may also want to respond to that.
Thanks, Pam. And building on what has been mentioned by other panelists, that when we think about data, mental health data, this interdisciplinary or inter-stakeholder approach is extremely important, because each of these actors and stakeholders bring different perspectives. Now, one of the important things, as similar to when we are looking at the data. So for example, as WHO, we approach ministries and get that data, but we know in many countries, sometimes even the services and the programs are run by NGOs. And so that data doesn't get captured. So I think that's an extremely, because we miss that kind of data from based on the services that NGOs are providing, and this is especially true for mental health. And also this also is important because many of the promotion and prevention programs are again run by NGOs, and we miss that kind of data. So. And I think what we need is, as we move forward with mental health in data collection and standardization, we need better kind of systems to be developed, and more at national level, where different stakeholders, including private sectors and NGOs, can contribute to those data collection systems. And then, of course, it goes without saying that any analysis and as well as any usage of data, that's again an important sector to be involved, simply because the ministries do not have all the resources that are required. But I see Cecilia, so she may like to add, coming from that sector.
Maybe, yes, Tarun, just to add to what you've said so far, I think one of the sectors that NGOs can contribute a lot is in adding data that refers to vulnerable groups such as refugees or migrants, because usually that's a very vulnerable population that it's never on the scan of, or not never, but in many cases, it's not scanned by governments. So I think for me, this understanding that there's some very specific vulnerable groups that we are missing the possibility of having or gathering specific data from these groups, I think that's where international NGOs have done some great work. And I think any NGO or local or grassroots organizations can actually add a lot of value on collecting and gathering that data that can then be integrated to national data. I do want to refer also to what Tarun was saying before on the budget and emphasize on this. I think our experience and my own experience of working in government is that it's very difficult to track the investment and the budget on mental health. And I think that if we're able to at least start tracking the investments in the health sector, we would be much better off just understanding the kind of investments that we're doing in mental health itself. And I would say for me, it's also quite interesting and important to start tracking budget information on the investments on preventive mental health, which is because most of the time we track like the general information, which refers more to specific delivery of services. And I think it's important to start working on a preventive mental health policy.
Yeah, definitely upstream rather than waiting for downstream actors to work on those. Okay, I know I'm nearly out of time, but I do want to ask this really important question, because this really refers to a very important continent in the world where we need to have attention on, and that's in sub-Saharan Africa. So in many countries in sub-Saharan Africa, data on mental health is still very scant. What could be the reasons for this, and what could be done to improve that? Be good to hear from anyone on the panel.
Pam, I can start, and one of the things that we are based on the analysis of the Atlas, I mean, I would totally agree that for many of the low-income countries, including many countries in sub-Saharan Africa, we do not have good quality data, and this or any data available. And I think this reflects lack of commitment to mental health and lack of commitment to data and lack of resources allocation to data. I mean, simply without commitment, without resources, we are not going to get that data. But I also think that there are opportunities. So for example, there are opportunities of working with some of the other data collection systems that are working in sub-Saharan Africa. So for example, let's say for HIV, there are data collection systems that have been established. We know of good data collections that have been established for maternal and child health services. We know that demographic health surveys, DHS, they are being carried out many of those countries. And therefore, I would encourage and urge that many of these, we should have mechanisms of integrating mental health indicators and using the existing data collection systems to have better data for mental health. So some of these solutions do not require extensive investment, but working together with, the surveys that are already being carried out so that some of these basic data that are for mental health burden, mental health services, we are able to get, and this will help countries in better planning.
Great, thank you very much. I think I'm running over time, so I'm going to have to call an end to these questions. Thank you so much. There's lots of great comment and further questions in the chat function. So this is definitely an area where there's, a lot of interest, and it'll be good to follow up on. So just to finish off nearly is just to do a kind of a roundup of key takeaways. If I could ask the panelists briefly, just to end with one sort of bullet point answer to a question, which is, what is the next area Countdown 2030 should focus on? So let's work backwards from the last person who spoke. Well, last person who spoke first. Suraj, if I could go to you. What do you think Countdown should be focusing on next?
Yeah, I think it's the quality data, and the quality data also train the people in the fields to collect the quality data. Yeah.
Okay, right. Quality. Cecilia.
Thank you, Pam. I think for me it's let's create awareness with data that allows to identify gaps, that allows to take action.
Good one. Taryn.
I think what I would like to see is with the data Pam, what you talked about is the social determinants and the link to the mental health. I think the next phase of the countdown should focus on that.
Thank you, Taryn. And finally, Liliana.
Thank you, Pam. I think coming from UNICEF, three main populations are so important for us: children, adolescents, and caregivers. So investing in getting data from them and investing in sustainable approaches, so that it's not extremely costly to collect this data, but using the systems that we have in ground, in routine system to collect data. And mostly continue working as a community in this field of mental health.
Great.
Thank you.
Thank you. Great. Well, that's it from the panelists and from us today on the webinar. I'd like to really close this panel today by thanking everyone, United for Global Health, the panelists, and of course, this amazing tool that we've now got, the Countdown 2030. I understand that there'll be a webinar next week from the United Mental Health Group, so please watch out for that. And we'd like to invite the audience and the panelists really to continue this discussion on social media. As many of you have mentioned, awareness and having attention be kept on this constantly is really key for action. We know that from the Lancet's work on global health, that as soon as we've done a big report, a commission, a series on something, we generate a flurry of interest, and then it all sort of subsides again. But the importance is to keep that dialogue and keep that conversation open and keep revisiting it. And I think with the mental health community, you know, you're becoming innovative, you're using new tools. This countdown is going to be a great mechanism. And I understand from all the discussions today, there are other initiatives that you're all much more linked into. So I see this as a really exciting time for mental health going forward. Thank you all. Bye now.
Thank you. Bye.